So we're in the home of Blake and Stacy Glenn and their children Caroline and Jack. And Jack had his first treatment last week, and I'm going to start working on his head while Stacy just talks to us about how he was before and how old he was when you brought him in, and anything you want to say, how he was before he came and how he was during his treatment and how he's been since then, and anything you want to talk. And then while you're doing that, I'm just going to gently put my hands on it and say, now, are you comfortable sitting like that?
Yeah, I'm totally.
Because what I'm going to do is grab a pillow, in fact, excuse me, just in case we need to change his position a little bit during or something for your arm. And there we go. Okay. All right. So.
All right. Well, Jack we brought him home from the hospital, and he was completely fine, perfect baby for about the first 2 weeks.
And what was the date of birth?
His date of birth was 1/9/08. We brought him home, and he, like I said, slept all the time, just like a newborn, was perfect. About 3 weeks, he would just continuously cry, inconsolably cry, all of the time. And we went to our pediatrician. She said, well, you're just going to have to wait it out. It's probably colic. That's what she said. She also advised that we go to a pediatric GI doctor. We went there. He found nothing wrong with his stomach, his eating, anything like that. They then said that he is probably just a high-maintenance baby. High maintenance, that's what they said. So we came home and we continued to have him cry.
And was it day and night?
Night wasn't so bad.
Okay.
It was just during the day. We couldn't, he wouldn't take a pacifier. A bottle wouldn't help. He would never lay down. He would never relax. I think that was the biggest problem with him. His hands were continuously clenched in a fist. His legs were going all the time. He never relaxed. And so my family, actually my husband's family, had been to Dr. Peters with their children, and always wanted me to go there. You really need to try it. You really need to see. It's wonderful what she does. I didn't believe it. I had never been to any chiropractor, let alone anyone that I wanted to touch my infant. I thought, well, I don't want them to pop him, to manipulate his body in any way. But I thought I was at my wit's end, and I couldn't do it anymore. And so I actually called my mother-in-law and said, I had talked to my husband, Blake, and we thought, what do we have to lose? We're going to do it. So Velvet, my sister-in-law, who has taken both of her children to Dr. Peters, called her. We were able to see her a couple days later. He would have been 5 weeks, maybe a little under, close to 5 weeks. I was very nervous going in. We went there, Dr. Peters. No, I was nervous because I didn't know what to think. My sister-in-law had explained to me that it was nothing like I had envisioned at all. But when we got there, Dr. Peters showed me how soft she touches him, as you can see.
Oh, the way I touched your arm or your
hand. I mean, and it's not, there is no pressure, there is no popping, anything like that. It doesn't hurt him. And so I was really, really surprised. And we got there, and we laid him down, and he cried on the table when we got there. And she started to touch him, and he went limp and just was so calm and so relaxed. And his hands opened up, his legs relaxed, and he laid there and very soon just fell asleep on the table, which we never could lay him down on a couch, in his bed, on the floor, anywhere without him screaming. And so just to see him laying there was amazing, and that he went to sleep. We always used to have to wrap him up real tight in a blanket. That's what they always told us to do, to swaddle him in a blanket. But we have since not had to do that since we went to our treatment. Of course, he does get fussy when he gets tired or he's hungry. He's still a baby.
He went like 5 days, or I forget how long was it?
4 or 5 days after his treatment, he didn't. He never cried. He used to get up 2 to 3 times a night, which is normal for a newborn, typically. But after the treatment, he was getting up only once, and then he would start the day about 6 o'clock in the morning, which is normal. But yeah, I mean, every aspect of him really has changed. As you can see, his hands when he lays down and they are above his head, like newborns should be. He's so relaxed. And last night we were here, and he just laid down on the floor and went to sleep on his own. We can lay him in his crib now, and he's 6 weeks old, and he goes to sleep on his own. He doesn't need a bottle. He doesn't need to be rocked. He will go in there, look around, and go to sleep, which to me is
so good.
Is wonderful.
One thing I remember was his fists. Remember how clenched they were when he first?
Yes.
Had they been like that pretty much?
Yeah, I'd never seen him really open his hands.
And wasn't it by the end of the treatment that his hands were almost
all the way open?
Yeah.
Mm-hmm. And now, as you can see,
they're very relaxed.
They are completely open all the time.
Yeah, and I remember when you were there, she was saying almost the whole time when she got past her apprehension of being nervous or whatever, I've never seen him like this, and I wish my husband could see him. He's so relaxed.
Yeah,
and that thrilled me.
It was amazing. I can't tell you how it was the strangest thing I'd ever seen, that he could just completely lay down and be so relaxed and peaceful and not screaming. So it really, there is an alternative to just being told that you have to wait it out. It's colic. Your baby's high maintenance. Like I said, we went to 2 different doctors and they told us the same thing. So
I know it doesn't look like much to the camera what I'm doing, but I have, because his head's so small, I have different parts of my fingers and hands and right now, almost all the bones of his cranium. And they have their own, each bone or pair of bones has their own distinct motion. And I'm monitoring that motion and allowing for space and for the fluids to move and help create more balance in the system, that's all. And in the membranes of the cranium start to unwind and open up, and it allows for better blood flow and lymph drainage, and of course the cranial nerves, 12 pairs of which are exiting the base of the skull, are allowed to exit more freely and thereby optimizing functioning. And all along Jack doesn't know anything about it. Nor does he care. He says, I'm just going to be able to put my energy into healthy growth now. Right? Yeah, he said, yay.
I just think the biggest thing with this is that so many people should understand that there are other options that aren't limited strictly to whatever your doctor tells you, your pediatrician tells you. I think so many people get nervous, I being one of them, that a newborn, they have no idea what they need, what they want, why they cry, and there's always other reasons that are strictly, that they don't understand or they don't know, or
We forgive them. I mean, I didn't know this stuff till I started doing it either. So
right.
I mean, and the way I've come to say it through the years is that they're just uncomfortable in their bodies. Doesn't that seem like an easy way to describe it? And I noticed that if you don't get this work done, my experience is if you don't get it done with the little ones, it persists. So then the 2-year-olds have it, and the 5-year-olds have it, and the 20-year-olds and the 50-year-olds. So I guess I talked to Stacy about my conviction of getting the word out on a bigger level of the importance of this work, because we can not only optimize growth and development in the newborn, but we can prevent a lifetime of distortional patterns that end up causing us to have to go to the chiropractor for our whole adult life. And I really mean it, because I have seen it just I've been doing this work with babies concentratedly for a decade now.
Well, and the youngest, what did you say, the youngest baby that you'd worked on
1 hour.
was an hour old. So, I mean, that's unbelievable.
It's so sweet. People sometimes ask me if I help with the birth and delivery, but in the Amish community, where I've gained so much experience, they traditionally have midwives, so they kind of separate it out. The midwives help them with the birth and delivery, and then they have me come for the baby treatments. However, of course, lots of women, like even your sister-in-law Velvet, have come to recognize the value of getting their own treatments so that their container is more symmetrical and their pelvis more open and less distorted or whatever, so that perhaps even, I've certainly seen it prevent some of these distortional patterns in the baby if they don't get stuck in one position or anything like that, particularly in the last few months when they're getting so big.